AUB, abnormal uterine bleeding, is a common problem in women in the reproductive age group. AUB leads to loss of productivity and may result in surgical interventions, including hysterectomy. In India, prevalence of AUB is around 17.9%. A levonorgestrel releasing intrauterine system, EMILY, is an alternative choice for effective management of AUB and also to avoid hysterectomy due to AUB. EMILY is a M-shaped intrauterine system containing 52 milligrams of levonorgestrel, releasing 20 micrograms of levonorgestrel per day. EMILY is indicated in AUB, adenomyosis, endometriosis, and contraception. Prior to insertion of EMILY, recommend the woman to undergo a per-vaginal examination. Clean vulva before the uterine sounding. Gently move a uterine sound into the uterine cavity to the fundus to determine the direction of the cervical canal and the uterocervical length. Now let us see the simple steps to be involved in insertion of EMILY. Step 1. Wear sterile gloves. Grasp the upper lip of the cervix. Make a gentle traction on the holding forceps to align the cervical canal with the uterine cavity. Step 2. Set the upper edge of the flange to the depth measured during the uterine sounding. Step 3. EMILY is now ready to be inserted. Gently advance the inserter tube into the uterine cavity until the flange meets the cervix and you feel fundal resistance. EMILY should now be in the desired fundal position. Step 5. Release EMILY and withdraw the inserter tube. The threads will release automatically. Check that the threads are hanging freely 3 cm length. Step 6. Cut the threads. EMILY insertion is now completed. Now let us see how EMILY helps control AUB and provides contraceptive efficacy inside the uterine cavity. Let us go inside the uterus. You can see EMILY is well placed. EMILY releases 20 micrograms of levonorgestrel per day. The therapeutic effects of EMILY are derived from the local effects of levonorgestrel released by EMILY. The release of levonorgestrel downregulates endometrial estrogen and progesterone receptors, supplying endometrial growth. After the placement of EMILY, the endometrial mucosa thins. Thereby, the bleeding becomes less in quantity than usual, solving the problem of AUB. By the local action of levonorgestrel, the weight of the cervical mucus increases, inhibiting the passage of sperm, hence acting as contraception also. EMILY is removed easily by pulling on the threads. EMILY releases a constant pattern of 20 micrograms of levonorgestrel over a period of 5 years. The M shape of EMILY adjusts to the uterus size and ensures proper insertion and prevents expulsion and dislocation. The soft and flexible side arms allow easy and pain-free insertion. The stiff and flexible sleeve can be bent slightly to accommodate. The insertion and removal of EMILY is very simple and can be performed in few minutes.